When the alarm sounds, everything has to go very quickly. The rescue helicopter is in the air within minutes. Christoph 31 flies to the rescue when it's a matter of life and death. Last year, nearly 120,000 people in Germany died of what's called sudden circulatory collapse. And once the blood stops being pumped around the body, every minute counts. But it usually takes some time for the patient to reach a clinic where they can be treated properly.
Here we can optimize things. The patients can be cooled down. We can put in a heart catheter if there's been a heart attack. They get optimal intensive medical care. But the decisive factor is what happened before they got here. That determines whether they even arrive here alive.
What can be done in the first minutes after someone has suffered cardiac arrest? That's a crucial question for the emergency physicians. Jan Breckvold collected data on cases over the course of a year. Were people on hand to help? What did they do? His study shows that the critical window of time is before the ambulance arrives.
Between the collapse and the time professional help arrives, there's a period we call the bystander's window that's at least 7 minutes long, and it's critical. If no medical intervention procedures are performed within this window, you can see that here quite clearly, then basically it's too late. Then you have brain death, and at that point there's really nothing more the rescuers can do.
Death makes no distinction between day and night. But exactly where a circulatory collapse occurs is very important for the outcome. The study found that 3/4 of all cases of sudden cardiac arrest ending in death take place in people's homes. But the greater number of people witnessing the event, the greater the chance of someone taking life-saving measures before the professional medics arrive.
We were able to analyze how effective the measures were. Under optimal conditions, if the people giving first aid perform perfectly, then survival chances are 7 times greater than when nothing is done.
But what are the chances that there'll be someone standing by who can really help?
The chances are actually pretty good. In public spaces, around 50% of the people react by giving first aid. At home, the numbers are worse. People only do something 20% of the time.
But the 50% statistic doesn't tell the whole story. Onlookers often don't realize something life-threatening is happening. Breckvold says there are huge deficits in first aid education in Germany.
In half of all cases, bystanders don't recognize cardiac arrest, so they do nothing. And even if they do realize what's happening, they're afraid to make mistakes. So they put the person in the lateral recumbent recovery position. That's all they remember from their first aid course. But that's about the worst thing you could do, because you can't reanimate in that position.
But how can an onlooker recognize circulatory collapse? Too many people end up standing around, unable to help.
Gasping for breath or suspended breathing combined with unconsciousness, that points to circulatory collapse. It's that simple. It happens very suddenly. The one who has it just collapses. Their skin color changes, it turns blue or gray.
Breckvold and his team now want to improve first aid training for the general public. In most cases, it would be enough if people could perform CPR until rescuers arrive.
Lots of measures are superfluous. In our opinion, the lateral recumbent position shouldn't be taught in the courses because it's the only thing that people remember and it hinders reanimation.
It's Christoph 31's 4th mission in a single morning. He will make thousands of rescue flights in the course of the year. And if more sufferers could be helped in the first minutes after cardiac arrest, more of the flights would have a happy outcome.